Welcome everybody to today's Narcan training that we at the SAFE Coalition are thrilled to be providing you. My name is Jim Derrick and I'm one of the trainers from SAFE. So the first thing we want to go over with Narcan is to start at the beginning. What is an opioid or an opiate and what is its impact on the human body? Opioids are the synthetic version of an opiate. Opiates obviously come from the poppy seed and that's where heroin comes from. Opioids are synthetic and they're manufactured. So think about OxyContin, Percocet, Dilaudid, or fentanyl. Those are all examples of synthetic opiates, or what we call opioids. So what are the impacts of opioids on the body? Well, the body has what we call an opioid receptor. And that opioid receptor is covered by an opioid when it's ingested. And that receptor is in part responsible for regulating the cardiovascular system. When the opioid enters the system and lays over that opioid receptor, the system becomes suppressed. Breathing slows down, heart rate slows down, and in the case of an overdose, actually the victim can stop breathing and loses their heartbeat. So when you come upon the patient that you suspect has overdosed, there are a couple of ways to determine whether or not they can be aroused prior to administering Narcan. The first way is to do what we call a sternum rub, and that's to take your closed fist and on their bare skin, rub quickly across the sternum, creating friction. It's very, very painful and oftentimes will elicit a response. The second way is to do the same thing with your fist and go to the septum, above, between the nose and the top of the lip, and rub back and forth. Another way to elicit a response so that you can determine whether or not somebody can be aroused. So now Narcan is an amazing drug. I like to refer to it as a miracle drug. The only impact of Narcan on the body is to release that opioid or opiate from the opioid receptor. That's the only thing it does. It's an opioid antagonist. So it releases that opioid from the opioid receptor and allows the system to reboot itself on its own. That's the only purpose for Narcan. Importantly, there has never been a recorded allergic reaction to Narcan in what has probably been hundreds of millions of doses that have been deployed throughout the world. This same dose of Narcan that I'm holding, which is 4 milligrams, it's the same dose that you would give to a toddler as you would give to an adult or to an elderly person. There's no need to adjust the dosing. And importantly, again, this drug only impacts opioids. It will not exacerbate any other medical conditions. So if you come upon somebody and you're not sure whether or not they're overdosing, Narcan can always be used without fear of harming them if they're not overdosing, okay? So how do we know whether or not somebody's overdosing? Signs and symptoms. Well, the first sign is obviously if somebody's in an overdose state, they're probably unconscious. They may or may not be breathing, and they may or may not have a heart rhythm. If someone's overdosing, oftentimes they will nod off. They literally will nod off. They'll look like they can't stay awake while they're on their feet, or when they're in a seated position, they may slump over. Their pupils are constricted. They call them pinpoint pupils. That's a sure-tell sign. Someone's extremities, their fingers, their toes, around their mouth may become bluish in color as they're struggling to get oxygen. And clearly, if they're overdosing, they may or may not be conscious, and they may or may not have respiration. When somebody overdoses, there is no respiration, and most often they are unconscious. So what do we do when we come up on somebody that appears to possibly be overdosed? Well, the first thing we're going to do is we're going to assess the scene. Now, a lot of times people will say, well, how do I know whether or not they're overdosing from a substance? Well, some of it is what I call common sense. You start to look around, you look at the person's age, maybe there's paraphernalia, maybe they're with other people when you find them that are using drugs. So some of this goes into, do I suspect that this person may be suffering from an overdose? You look at the person, you see some of the symptoms, and that's going to give you a cue as well. So once you're fairly sure that you're you've come across somebody who's overdosed, the first thing you're going to do is call 911. This is a critical thing to do. You're calling 911, you're going to tell dispatch that you're with, in this case, an adult male, appears to be in his mid-30s. You're treating this as an overdose. You have Narcan with you. You've got, in this case, one of these boxes has 2 4-milligram doses of Narcan. So you have Narcan with you, and you're going to treat the patient. You can then tell dispatch that you're going to start with compressions. So our training tells us that it's 5 chest compressions. 2, 3, 4, 5. The purpose of that is to try to get some oxygen into the person's system. They have been depleted from oxygen and aren't breathing, and you want to get that restarted before you use the Narcan. You're then going to deploy the Narcan. So with Narcan, it's very, very simple to use. It is a lot like Afrin. The container, that's a 4-milligram dose, and that 4-milligram dose is deployed by 1 punch on the plunger. So I'm going to demonstrate that here. This is 1 dose, 4 milligrams of Narcan. That's all there is to it. I simply hit that plunger. So your goal is to get this Narcan into the nose of the person that's overdosing. It must be used nasally. So you're going to look at the person and you're going to deploy the Narcan into the side of the nose that has the least obstruction. So oftentimes people that are in an overdose status may vomit, there may be mucus, maybe they've been injured, maybe when they fell there's blood coming from the nose. In that case, you're going to go to the freest nostril and deploy that Narcan just as I did before. Immediately after plunging the Narcan and delivering 4 milligrams into the patient, you're going to do 30 chest compressions. 3, 4, 5, 8, 9, 30. At that point, you're going to step back. You're going to tell dispatch that you've deployed 4 milligrams of Narcan to the patient and you've delivered another 30 chest compressions, and you're now going to wait 2 minutes to see whether or not the Narcan elicits a response. Now, oftentimes, the person won't respond to 1 dose of Narcan. Okay? Many, many times, because of the potency of the drugs that are on the streets like fentanyl, it takes 8, 10, 12 milligrams of Narcan to get any type of response. So in this case, our patient doesn't respond. After 2 minutes, we're going to take out the second 4 milligram dose of Narcan, and we're going to repeat the steps that we just did. So we're going to deploy the second dose, ideally in the other nostril, in the opposite nostril from the first. But again, if that nostril is clogged, where you can't see any free and easy access, then use the same nostril is okay. You deploy that Narcan, and you're going to complete 30 chest compressions once again. 30. You're going to tell dispatch that you've deployed another 4 milligrams, so now a total of 8 milligrams of Narcan. You've done 30 more chest compressions, and dispatch will be talking to you. Now, if that's all the Narcan that you're carrying, then it's important that you talk to dispatch about an EMS as they're en route about continuing chest compressions. Dispatch will give you advice on what to do in that case. But know that when EMS rolls up, they will be ready with more Narcan and be able to intervene and hopefully save your patient. So really, just for a quick review, know that an opioid lays over the opioid receptor and suppresses breathing and suppresses your cardiovascular system. All the Narcan does, it's an opioid antagonist, is it temporarily reverses that overdose. And temporary is an important word because it releases that opioid from the opioid receptor and allows the person's system to reboot. However, if that person is left and not taken into the hospital for observation, that opioid can reattach to the receptor and they can re-overdose. So it's always important 100% of the time to take the victim to the hospital after overdose has been reversed. Finally, know that there has been no known allergic reaction to Narcan and that there is no dosing adjustment, that you can give the same dose to a toddler as you would give to an elderly person. This is a benign substance with the only exception being that it releases opioids from opioid receptors. And that is Narcan training.